Test, test, test. Testing the mic. Good.
Okay. Once again, good morning. Okay, today is December 16th and the time is now 10:10. My name is Ina Lightborn and I'm a project analyst with the Healthcare Planning and Certificate of Need Section, Division of Health Service Regulations. We are in Asheville today to conduct a public hearing on 4 competing proposals to develop no more than 129 acute care beds pursuant to the 2025 need determination. The four applicants are UNC Health West Medical Center, Inc., project ID B12708-25. Novant Health, Inc. and Novant Health Asheville Medical Center, LLC, project ID B12709-25. Avon Health Asheville, Inc. and Avon Health Systems Sunbelt Healthcare Corporation, project ID number B12716-25. And MH Mission Hospital, LLLP, project ID B12720-25. I am now going to briefly review the process for today's hearing. Each applicant will be given a maximum of 15 minutes to describe the major components of its proposal and respond to any written comments submitted to the agency during the 30-day public comment period. Pursuant to North Carolina General Statute 131E185A12, applicants are not allowed to comment about another applicant's proposal. The applicant should have prepared to be handed to me immediately following the oral presentation. The written response may be more detailed than the oral presentation. After the applicants have completed their presentation, members of the public will be given the opportunity to make comments regarding the applications under review. We ask that employees, consultants, or other persons who represent an applicant in an official capacity, should speak only during the applicant's 15-minute presentation and not during the public comment period. Members of the public who wish to speak will be asked to indicate which proposal they support, if any, and to provide their name and contact information on the sign-up sheet, which is, I have some on my desk if there are some people who wish to speak that have not signed. We ask that members of the public limit their comments to no more than 5 minutes each. The sign-up sheets will be shuffled and names called at random, alternating between supporters and opponents of the proposal. Only those persons who are in attendance at the public hearing may comment on the application. It is not permissible for one person to read a letter written by another person in the record of the public hearing. A speaker may provide transcripts of his or her oral remarks made at the hearing. Following the public comments, each applicant will be given up to 5 minutes to respond to the public comments made during the public hearing. Today's proceedings are being recorded, so before beginning your comments, please state your name for the record. I just wanted to mention that we have a microphone, so that's for the members of the public if they want to get up and speak instead of having to come all the way up here. So I just wanted to let you know there was one on this side that she must have removed it. Are there any questions? You sure? If not, at this time, UNC Health West Medical Center, Inc. may come forward and begin its presentation.
Good morning, everyone. That's right. My name is Christy Page, and I am the CEO of UNC Health and the Dean of the UNC School of Medicine. And I'm joined today by Jay Kirby, the President and CEO of UNC Health Pardee, as well as Jeff Lindsay, the President and Chief Operating Officer of UNC Health. We are truly honored to speak with you today about our application to develop UNC Health West Medical Center, a new 129-bed acute care facility in Buncombe County. If approved, UNC Health West would be the only hospital in southern Buncombe County and would address a significant need for healthcare services in Western North Carolina, a region we have been privileged to serve for many decades. I am a lifelong North Carolinian and a Tar Heel, and over the past 20 years with UNC Health, our mission has become deeply intertwined with my own sense of calling and purpose. I was drawn to medicine and specifically to family medicine because of a desire to serve and to form long-lasting relationships with patients and communities. After college, I had an experience where I traveled to all 100 North Carolina counties. And that experience opened my eyes to the very real gaps that exist between urban and rural areas. Those gaps in healthcare access have stayed with me throughout my career, and addressing them remains central to our work at UNC Health. Currently, UNC Health, which would be the majority member of our proposed hospital, operates 20 acute care hospitals, ranging from level 1 trauma centers and academic teaching hospitals to rural and community hospitals that provide critical care to the underserved. Much of these hospitals are in Western North Carolina, including UNC Health Pardee, which Jay will speak to shortly. Our services are exclusively in North Carolina. And UNC Health has deep roots in every corner of our state and brings resources and expertise that we believe can uniquely serve the needs of Buncombe County. Our commitment is not just to provide health care, but to create a healthier future for the people and the state that we all love. And in short, we are committed to doing work that matters, and this hospital matters. We've been honored to serve the patients of Western North Carolina for many years through the outstanding services of UNC Health Pardee, yes, and UNC Health and the UNC School of Medicine have a long history of partnering with practices, providers, and training medical students and residents in the area. We are affiliated with MAHEC, the clinical training and clinical care provider in Western North Carolina, and many members of the UNC School of Medicine faculty provide education to MAHEC students through the UNC Health Sciences at MAHEC, a teaching health center that includes a branch campus of our UNC School of Medicine. So today, we support 366 faculty appointments at this campus and have 255 alumni of the Asheville Medical School campus that are now practicing in the region, making this campus the largest and longest established regional campus of our School of Medicine. This work is deeply personal to me. I've spent much of my career focused on rural healthcare workforce solutions and ensuring that future healthcare professionals are prepared to serve communities such as those in Buncombe County with excellence is not only a responsibility to us, it's a great privilege. A new hospital in Buncombe County will benefit substantially from these educational partnerships and resources for clinical and professional training to get the right kinds of providers in the right areas of Western North Carolina. While we certainly anticipate UNC Health West will be a natural destination for our students as they graduate, we've also been encouraged by the strong support for our proposal from practicing physicians in the area. Our application includes nearly 300 letters of support from leaders and community members of the Western North Carolina region, including support from physicians across numerous specialties, key community leaders, and residents who believe, as we do, that expanded access to high-quality care is needed in this area. As many of you here today are familiar with this community, I don't need to tell you about the challenges facing healthcare in the area. Buncombe County is the largest county by population in Western North Carolina, and as such, a healthcare destination for many patients seeking specialized care that is typically not available in most rural and community hospitals. The approval of an additional hospital in Buncombe County, one that would provide vital acute care capacity in the region's largest population center, would significantly expand access to care for the patients of Western North Carolina. And we believe UNC Health, the largest public academic healthcare system in the state and one that is focused solely on North Carolina, can bring both the clinical expertise and the educational infrastructure needed to serve this community well. But more than that, we believe that we bring a true and authentic commitment to serve, not for institutional achievement, but because we have found like-minded, mission-driven people with the same goal, to make a lasting and positive impact on the health of the people we serve. To speak more about how UNC Health has successfully served this region through our work with UNC Health Pardee, and how that strengthens our ability to operate UNC Health West for the good of the community, I'd like to turn the floor over to Jay Kirby. Thank you very much for your time and consideration today.
Thank you, Dr. Page. Good morning. My name is Jay Kirby, and I have served as president and CEO of UNC Health Pardee for nearly 15 years now. We are a flagship provider of care in Western North Carolina, operating a 222-bed acute care hospital in Henderson County that is proud to serve patients not only across our region and across our state, but beyond our borders. Our significant experience providing care has given us insight into the needs of the greater Western North Carolina area. As a largely independent provider of care that is managed by UNC Health, we are uniquely positioned to speak about why a new hospital in Buncombe County under UNC Health's leadership would go a long way towards expanding access to care for our residents while ensuring that care is delivered by physicians and clinical staff of a proven high-quality UNC Health provider. I want to be clear about UNC Health Pardee's involvement in this application, why it matters. Pardee Hospital does not just stand for longevity and local understanding. It also represents demonstrated excellence in quality outcomes, patient safety, and community responsiveness. These measurable achievements distinguish us in ways that are frankly uncommon for a hospital our size. UNC Health Pardee is the only hospital in Western North Carolina to earn both a 5-star rating from the Center of Medicare and Medicaid Services and an A grade from the Leapfrog Group for patient safety this past year. To put this into perspective, there are more than 100 hospitals across North Carolina, and Pardee Hospital is only one of 8 to receive the 5-star rating from CMS in 2025. In fact, based on this achievement, UNC Health is the only UNC Health system in the North Carolina to have multiple hospitals with the 5-star status, a distinction that speaks to the consistency and the rigor of care that we see across the continuum of UNC Health. Our commitment to patient safety is not just a priority, but it's embedded in everything we do. Beyond these national recognitions, Pardee Hospital in Hendersonville has received gold awards from the Asheville Media Group, honoring us as the best hospital in Asheville every year from 2021 to 2025, despite us not having a hospital here in Asheville. The consistent consumer preference reflects the trust that residents across the region place in both UNC Health and UNC Health Pardee. They choose us because they know they will receive exceptional care. UNC Health Pardee is also only one of 2 STEMI certified emergency hospitals across the region. We were designated a PCI hospital by the North Carolina EMS medical director, and this designation is reserved for facilities equipped and with personnel, infrastructure, and expertise to diagnose and treat patients experiencing ST elevation myocardial infarction, the most serious type of heart attack. For patients in cardiac crisis, every minute matters. Having this capability in Henderson County means patients can access advanced life-saving cardiac treatment close to home rather than having to be transported hours away during the most critical window of hour. We are also the first healthcare organization in Western North Carolina and in the entire UNC system to administer lecanemab, a newly FDA-approved medication for the treatment of Alzheimer's disease. This milestone reflects our commitment to bringing the most advanced treatments to our community as quickly as possible, ensuring that our patients don't have to travel to urban centers to access cutting-edge care. Our dedication to Western North Carolina's residents extends well beyond the walls of our hospital. We provide care through Party Blue MD, our network of primary care offices spanning 22 locations across Western North Carolina, including 5 offices here in Buncombe County. We deliver specialty care services across the region that include cardiology, neurology, orthopedics, sports medicine, endocrinology, bariatric, general surgery, and now neurospine care. We provide athletic training coverage for 25 middle and high schools across the region, including 11 schools here in Buncombe County. In other words, we're not newcomers to Buncombe County. We are experienced operating here, and we intimately understand the healthcare needs of the communities, and UNC Health proposes to serve those same things here. This deep operational knowledge of our region was put to the test during Hurricane Helene last year, when the storm caused billions of dollars in damage and upended the lives of millions of residents across our region. As a trusted provider of care throughout our community, UNC Health Part E responded in turn to this catastrophic event. When a neighboring facility faced water outages that impacted their ability to deliver babies, our obstetrics and gynecology specialists immediately reached out and offered help. We ensured that our hospital would serve as a destination for late-term mothers who needed a hospital setting to deliver their babies safely so they wouldn't have to travel hours away and outside of the community during this time. Additionally, when other hospitals were on diversion or physically inaccessible, we continued to receive all ambulance traffic despite our own extraordinarily high patient volumes, and when through many of our own providers, themselves members of our community, were facing significant travel challenges in their own storm at home. Considering that much of our area was inaccessible, numerous roads were impassable to storm damage, our facility was able to be a literal light in the darkness for those who needed essential care. What Hurricane Helene demonstrated was not only our operational capacity during crisis, but our commitment. Our ability to respond effectively was made possible through our partnership with UNC Health, which immediately deployed clinical teams from across the state to support us and our region. UNC Health's Carolina Air Flight team and ground crew spent a week in Henderson County reinforcing local emergency management services and our patient transport needs. This kind of integrated system-wide support from UNC Health is what you can expect from UNC Health West in Buncombe County should we win this award. While Helene may have been a once-in-a-generation storm, it highlighted many of the persistent challenges faced by our communities. Western North Carolina, as many of you know, is largely rural, and many patients in our area struggle to reach accessible healthcare services due to the mountainous geography. Many of our communities are also home to patients whose annual incomes are lower than the statewide average. These patients' financial situations are often impacted by their ability not only to pay for their care, but to choose that care in the first place. Many of our initiatives at Party have worked to address these disparities, and we discuss them in great detail in our application. However, geographic access matters, and there are few substitutes for the development of a new comprehensive location of acute care services. The ability to reach a hospital in an emergency and receive treatment quickly can be the difference between life and death. Having access to follow-up care is the difference between recovery and readmission. As the cornerstone provider of acute care services in Henderson County, UNC Health Part E wholeheartedly supports the development of a hospital in Buncombe County that will serve the patients of Buncombe, Graham, Madison, and Yancey counties. Many of our physicians anticipate referring their patients to this facility, and many are eager to potentially provide care there following its development. This physician support, which Dr. Page discussed and which is documented in our application through hundreds of letter supports, reflects their confidence in UNC Health West and that we will uphold the same standard of excellence there that you've come to expect at UNC Health Part E. I am confident the high quality of care will be provided at UNC Health West, and I am certain it will be welcomed and a trusted and respected provider in Western North Carolina. Our record of achievement, Our proven ability to respond to community needs and our deep understanding of this region make us an exceptional partner in this endeavor. The residents of Buncombe County and the surrounding area deserve the same level of care that has earned UNC Health Party national recognition, consistent consumer preference, and the trust of this community. Again, thank you for your time here today, and we urge you to approve the application to develop UNC Health West. Thank you.
Before I call the other applicant, I just want to ask if there are any members of the public who wish to speak that have not signed up. Okay, we'll hear from Novant Health.
Good morning. Thank you for the opportunity to speak today. My name is Andrea Flynn, and I am the Vice President of the Cancer Institute at Novant Health. I sincerely appreciate the community members and healthcare professionals who are here today to lend their voices to advancing healthcare in Western North Carolina. Your time, commitment, and contributions are essential to this process. Novant Health recognizes that the core issues of this CON review cycle center around Buncombe County and Western North Carolina's access to quality health care. Throughout this entire process, Novant Health has been very intentional in pursuing a new hospital, not as a matter of competition, but as a matter of options and providing the community with another choice for health care. This ensures every person in the area has meaningful access to the level of care they deserve closer to home. Today, we're here to describe how Novant Health Asheville Medical Center has the potential to deliver the health care that truly belongs to Western North Carolina. The agency is identified needs of the community. Novant Health is proposing to establish a 34-bed acute care hospital in the Arden community in Buncombe County. The 34-bed hospital will consist of 30 general medical surgical beds and 4 ICU beds, as well as 10 unlicensed observation rooms. The hospital will have 4 procedure rooms built to operating room standards. Novant Health Asheville Medical Center will have a full-service 24-hour emergency room and all other necessary acute care, ancillary, and support services. Novant Health application is intentionally modest. It's based squarely on the number of beds we can confidently fill through specific identified referral sources. We're not asking for more than the community requires. We're asking for the number we can responsibly operate to support local patients, regional clinicians, and Western North Carolina care pathways. The additional applicants can absolutely meet the needs they've identified with fewer than 129 beds. In other words, Western North Carolina can gain additional healthcare options without exhausting the full bed need on any single proposal. And that gives this region the flexibility and diversity of care it deserves. One of Novant Health's greatest strengths is our proven track record of operating high-quality, smaller community hospitals across North Carolina. You don't have to look far, for example. In Kernersville and Clemens, for instance, Novant Health successfully operates community-focused facilities that provide exceptional care, attract top physician talent, and maintain strong patient satisfaction ratings. In the Charlotte region, Novant Health has successfully developed several small community hospitals, most recently Novant Health Mint Hill Medical Center and Novant Health Ballantyne Medical Center, both of which have fewer than 40 licensed acute care beds. These hospitals are designed to serve the surrounding communities. They operate efficiently, deliver meaningful choice, and are examples of what Novant Health would bring to this region. Our commitment to Western North Carolina is not new, and we've made substantial investments in this community. These include expanding physician access and partnering with local clinicians, During Hurricane Helene, for example, Novant Health supported communities across the Western North Carolina area by ensuring continuity of care and standing with patients and partners during an incredibly challenging moment. We mobilized emergency care services and resources, coordinated with local organizations for community outreach, and provided well-being and mental health services. Notably, the heroic efforts of Dr. C.J. Atkinson assisting a woman trapped by the hurricane with a breech baby due at any moment highlight the extraordinary commitment of our Novant healthcare team. Our swift and compassionate response underscores our unwavering commitment to serving those in need during this challenging time. That is what true neighbors do. Physician recruitment is also a core strength for Novant Health. We attract top talent because physicians know they will be supported with advanced tools, clinical autonomy, and access to nationally recognized institutes in cancer, surgery, neuroscience, and more. When physicians choose Novant Health, they are choosing an environment focused on collaboration, research, innovation, and compassionate care. This is the same environment we will cultivate at Novant Health Asheville Medical Center. So what will Novant Health deliver to the people of Buncombe County and the surrounding communities? Here are just 3 of the countless benefits. First, Novant Health can improve geographic accessibility. Many residents still face long drives for services that should be available closer to home. Novant Health Asheville Medical Center can provide a local option for advanced care that reduces barriers, reduces travel strain, and keeps families close during critical health moments. Second, Novant Health can provide meaningful healthcare options. Options ensure that every patient, regardless of their circumstances, can select the provider who best aligns with their needs and their values. Third, Novant Health believes in enhanced quality of care. We are known for statewide for delivering remarkable care. Our leadership institutes in cancer, surgery, and specialty medicine will support this new hospital with clinical expertise, operational excellence, and a patient-first mindset that has defined our organization for decades. We are anchored to a simple principle. Novant Health wants to be the neighbor Western North Carolina needs. A neighbor who shows up, a neighbor who invests in the community, and a neighbor who is here for the long haul. Our purpose is clear: to make healthcare more accessible, more advanced, and more local. That purpose is what drives us, from recruiting physicians to building ambulatory care centers to investing in communities in both ordinary days and extraordinary crisis. Our mission is to provide Western North Carolina the healthcare options it deserves. And that is the role we intend to play here, not as a corporation, but as a community partner. Neighbors have a right to more than one healthcare option. Families are entitled to high quality, local, compassionate healthcare. You should have the choice to stay close to home for the care you need most. We are grateful to everyone who speaks today and petitions for more healthcare options for Western North Carolina. Your willingness to stand here affirms what we're hearing across the region. Novant Health is the neighbor Western North Carolina deserves. A partner whose values align with the character of this community, grounded, resilient, and committed to its people. Thank you again for your time, your consideration, and your dedication to shaping a stronger healthcare future. We look forward to continuing this journey with you, and as we work to bring healthcare that truly belongs to our Western North Carolina backyard. I'd like to welcome Dr. Ioana Mazotis up now. She is a surgeon in one of our practices and the medical director for the region.
Good morning, everybody. I'm Dr. Ioana Mazotis, and I'm an endocrine surgeon with Novant Health Surgical Partners, Biltmore. I care for patients across Western North Carolina, many of whom are facing complex diagnoses, difficult choices, and time-sensitive treatment needs. I'm honored to speak today because the decisions made here directly affect the patients I see every day. Before joining Novant Health, my practice's work with for-profit healthcare corporations impacted our ability to provide essential care. We felt the difference in our daily work. There was less transparency, and we lacked critical physician support. Novant Health offered something fundamentally different. The culture is guided by physicians. Decisions are more transparent. Investment in specialty care is intentional and patient-focused. Because of that, our physicians feel more supported and our patients feel the impact of a more patient-centric care model. Wait times are down and access to specialty care is improving. Today, we have a growing network of Novant Health-aligned physicians and APPs across Western North Carolina. That matters because when clinicians work together to share systems, insights, and a common commitment to quality, patients experience more seamless care. Their information moves with them, their referrals are quicker, their options expand. And that brings me to an important point. Options matter. As clinicians, every day, we see how patients benefit when they have healthcare options. Choices create opportunities for second opinions, alternative care pathways, and different approaches to treatment. When patients can choose their provider or medical environment that fits their needs, their experiences and outcomes improve. They become more engaged and empowered in their care. Novant Health Asheville Medical Center would bring that kind of choice and opportunity to Western North Carolina. For patients, it means more accessible care, less travel, and more locally available services. It means the quality associated with Novant Health's facilities will be available here, supported by a team that's proven it can deliver exceptional outcomes in communities of all sizes. It includes new technology, new care models, and a fresh infusion of resources dedicated to improving the patient experience right in our backyard. For physicians, Novant Health Asheville Medical Center means the ability to practice in an environment that values clinician leadership and invests in the tools necessary to provide remarkable care. It means more opportunities for collaboration across specialties, easier access to referrals, and a system that allows practices to grow in ways that benefit our patients. Novant Health recognizes the uniqueness of the Western North Carolina region. They did not bring in outside physicians or impose a one-size-fits-all model. They sought the clinicians who were already here taking care of patients and asked how they could support our work. That approach reflects an understanding of what our community values and signals a genuine commitment to partnership. In the past few years, Novant Health's commitment has become visible in real and meaningful ways. Specialty care has expanded in areas such as surgical oncology, colorectal surgery, endocrinology, women's health, plastic and reconstructive surgery, and breast care. Partnerships with local medical oncology and radiology groups have strengthened coordination of care for our patients, especially for our cancer patients. These are investments that improve care for our community. Novant Health also demonstrated its commitment during Hurricane Helene. Clinics reopened quickly, mobile care units were deployed at no cost to patients. Care teams worked to ensure that treatment could continue. That's what it means to show up for a community, especially a community in crisis. Novant Health has already begun building the foundation for a long-term, sustainable healthcare system that supports the people who live here and the providers who care for them. As a surgeon, I see how important that foundation is every day. Novant Health Asheville Medical Center represents a continued commitment by a healthcare system that understands the needs of North Carolinians. This hospital would shorten delays, strengthen specialty services, and allow patients to stay close to home for the care that they need. It would allow physicians to fully support their patients' needs. As a physician, I can tell you that this isn't about corporate healthcare entities or for-profit healthcare. It's about the people we serve and ensuring that Western North Carolina has the essential infrastructure that keeps families healthy, providers supported, and healthcare at home. That's why I'm here today. I've seen a positive impact Novant Health brings to communities like ours. I'm convinced that Novant Health Asheville Medical Center will continue its dedication, making our region a leader in advanced medical care. Let's bring the healthcare that truly belongs in Western North Carolina to our neighbors, friends, families, and ourselves. I hope you'll agree that Novant Health is the neighbor we want to ensure Western North Carolina has a healthier future on the horizon. Thank you for your time.
We'll hear from Avon Health.
Good morning. My name is Delina Lukowitz, and I'm proud to be a 10th generation native of Western North Carolina. It is truly an honor to be with you today, and amongst so many community leaders, thank you for taking your time out of your day to be here. As I prepared for this public hearing, I couldn't help but think about Hurricane Helene and the devastation it caused in Western North Carolina. The service area for this 129-bed application was among the most impacted, namely Buncombe, Madison, and Yancey counties. During the storm, we were reminded of the courage, generosity, and resilience of our communities and our neighbors. We also learned about infrastructure challenges in our region and the need to be more resilient and prepare for future disasters. The media consistently praised local hospitals and their heroic responses to the unprecedented challenges of delivering care during this most historic storm. The articles rightly focused on Mission Hospital and its incredible efforts to overcome the unimaginable adversity of caring for patients without a normal water source for almost 9 weeks. We are all profoundly grateful to the staff and the true heroes for their selfless service. As reporters recounted the heroism of healthcare workers after the storm, they consistently noted that Buncombe County only had one hospital, and the region only had one trauma center, and only one tertiary care hospital. Only can be good or bad. Only can be good when my husband tells me I am the only one for him. Only can be bad when it means only one lane of I-26 is open, which I understand happened today. Only can be delightful when you get the only donut left at the bakery. Only can be bad when it means only one hospital system with a single water system to serve a county of almost 300,000 people. Only can be problematic when it means only one tertiary hospital in the region. Only can be dangerous when it means only one trauma center in Western North Carolina. These concerns were eloquently reflected in a recent op-ed by members of the Buncombe County General Assembly delegation that speaks about the infrastructures Helene exposed. Infrastructure, they wrote, included roads and bridges, electrical grid and water systems, and things like schools and healthcare systems. They described Mission Hospital as a vital part of WNC's infrastructure and the only level 2 trauma center west of Charlotte, and the only tertiary care hospital in our 18 westernmost counties. If a community member requires advanced and specialized care for trauma, heart surgery, stroke, or pediatric intensive care, Mission is the only option, they said. When Mission isn't properly functioning, they wrote, that is just as a concern as when I-40 is washed out. The lessons from the storm are not personal. They are not about an organization or a brand. They are about building a resilient healthcare network designed to meet the needs of a growing region in preparation for the inevitability of future disruptions. The region needs another high acuity tertiary care hospital, not because the existing facility is good or bad, but because it is the only one. Before Hurricane Helene, Advent Health was applying for a certificate of need. I would argue after Helene, we are applying for certificate of necessity. Advent Health's approved 93-bed hospital in Buncombe County was designed to meet the community's needs for healthcare choice and competition in the service area. The necessity is Western North Carolina is now another tertiary hospital and a trauma center. There are other excellent health systems applying for these beds, but just building another community hospital in Buncombe County will not address the infrastructure weaknesses that Helene has revealed. With its approved 93-bed hospital, Advent Health plans to develop a 222-bed facility, and it's the only application that would allow the scope, scale, and acuity necessary to create another tertiary hospital and trauma center to truly address this healthcare necessity for Western North Carolina. And the additional blessing would be that this new hospital in Weaverville is on a different water system and an electrical grid than downtown Asheville. Last month, Advent Health was honored to host community leaders at a site of our new hospital where the 129 beds could be located. The local television station covered the event and asked Mission Health for a comment. The spokesperson shared that Mission Hospital accepts thousands of transfers from other hospitals in the region because, I quote, patients need high-level medical care only available in Western North Carolina at our hospital. Mission's comments encapsulate the problem Advent Health is uniquely positioned to solve for the people of Western North Carolina. Thank you so much for your time. It is a pleasure to introduce our Chief Medical Officer, Dr. Byron Dixon, to explain how Advent Health's 222-bed hospital can meet this need.
Thank you, Delina. Good morning. It is such an honor to be here this morning. My name is Byron Dixon, and I'm blessed to serve as the Chief Medical Officer for Advent Health's North Carolina market. I'm also a board certified emergency medicine physician, and I've served as the medical director for the emergency department at Advent Health for a number of years. My clinical background and my professional experience, along with my experience leading our incident command through Hurricane Helene, has given me significant insight and makes me uniquely qualified to address the concern that Western North Carolina has only one tertiary care hospital and only one trauma center capable of taking care of the most complex trauma cases. Community hospitals do rely heavily on Mission Hospital because it is the only tertiary care hospital to refer to in the region. The lack of options often creates a bottleneck and puts a significant strain on the region's healthcare system. The lack of options often leads to delays in definitive care, which can lead to less than optimal outcomes and can negatively impact the patient's experience, certainly frustrating patients and their families. As an emergency medicine physician and former medical director of our emergency department, and as CMO who has led through the devastation of Hurricane Helene, I have seen firsthand the negative impact that having only one tertiary hospital can have on the quality and safety of care being delivered to our community. Our patients, our community, our region want a choice and a second option. They deserve a choice when it comes to receiving high acuity care. Advent Health's new 222-bed hospital in Weaverville will help meet everyone's needs. If we are blessed to receive these 129 additional beds, Advent Health will create the scope and scale to give patients in the region another option for high acuity care while helping our friends at Mission carry the load of complex care. I have done a deep dive and spent a significant amount of time reviewing the most common diagnoses that have traditionally required a transfer to Mission Hospital. I'm confident that the majority of these cases could easily be cared for at Advent Health's new 222-bed hospital in Weaverville. They would receive timely, high-quality, evidence-based care, all while receiving an incredible patient experience that Advent Health is well known for. Allow me to share more details around this. We plan to bring a broader range of advanced services closer to home for families across Western North Carolina. These services include a new trauma center, robust cardiac services, including a cardiac cath lab, neonatal intensive care services, comprehensive cancer care, along with neurology and advanced stroke services. Growing up in East Tennessee, I have a passion for rural health. I am certainly aware of how critical healthcare proximity is to the folks living in these rural communities. I'm super excited that the new Advent Health Hospital in Weaverville will serve rural communities such as those in Madison and Yancey counties that are so close to my heart. I have spent time visiting these communities and meeting with local medical providers like Hot Springs Health and Mountain Community Health Partnership to learn more about the local needs. I've also met with local EMS agencies and first responders to understand how geography impacts care and outcomes for rural residents. What I have heard time and time again was that folks don't want to leave their community for care. They don't want to navigate the unpredictable traffic driving into Asheville, especially for time-sensitive emergencies. They want more than one option for tertiary health care and complex trauma care. I deeply respect my friends and colleagues at Novant and UNC Health, as they are excellent healthcare systems. However, their proposed community hospitals would fall short in meeting the region's needs. What do I mean by that? If another community hospital is approved, Mission would still be the only hospital in the region with the scope and scale to be able to care for the more complex medical and trauma cases. Thousands of patients would continue to require transfer to Mission. This would continue the healthcare bottleneck situation that we find ourselves in currently, negatively impacting timeliness to critical healthcare services and potentially impacting outcomes. I would suggest that just about everyone in this room understands the importance and the evidence that supports timeliness to care and how it drives positive outcomes. This is especially true with patients who are having a stroke, a heart attack, or are in need of trauma care. It would be a real missed opportunity for our patients and our region's healthcare infrastructure if we do not create another option for tertiary care. The highest and best use of these 129 beds would be to combine them with Advent Health's approved 93-bed hospital in Weaverville to create another tertiary care facility and trauma center. Thank you for your consideration.
Well, good morning, everybody. My name is Graham Fields, and I am honored to have been part of the Advent Health team for almost 17 years. As a sixth-generation native of Buncombe County, my roots don't go quite as far as Delina's, but it makes this project very, very special to me and my family. The Certificate of Need process is about people, and my goal today is to introduce you to the people who matter the most. I want you to meet my grandmother. I've got a picture of her right up there. Her name was Annie Sue Fields, but we just called her Granny. She lived in the service area for Advent Health's new hospital. The Certificate of Need law would have euphemistically described her as low income, but my daddy said they were always just poor. Granny was a skilled seamstress, and she actually made my mother's wedding dress. She lived most of her life in a house that my grandfather's grandfather built, a 19th century house, you can see on the end, that lacked indoor plumbing until the 1970s. I vividly remember the day we got the call that Granny and Granddaddy's house was on fire. Miraculously, everyone escaped with their lives, but the house burned to the ground. They lost everything. Over 100 years of history, memories, and photos were gone. You might not realize it, but my granny inadvertently pioneered the practice of photo backup way before the cloud. You see, Granny seldom had money for Christmas presents, so her gifts were heartfelt, not store-bought. Each year, she filled dime store photo albums with wonderful old family pictures and entrusted them to her grandchildren for safekeeping. I want you to see one of these precious albums that I treasure so much. While I always loved the pictures, you know what delighted my heart the most was what she wrote on the back. For each picture, with her precious handwriting and the occasional misspelling, she lovingly told me who each person was and why they were worth remembering. Even for people we never met, she wanted us to know that they mattered. I wanted you to see a few pictures, but more importantly, what Granny wrote. My favorite, you can see it. This is your dad when he was a baby. He was so cute. I loved him dearly. It's a picture of the old house where my father grew up and where Granny and Granddad lived until it burned. You know, our team at Advent Health spent almost 4 years getting to know the communities in the CON service area. I personally drove over 12,000 miles for this application alone. I had the privilege of meeting thousands of incredible people who have become like family to us. Their support and enthusiasm for Advent Health's vision to bring another tertiary hospital with trauma services has been overwhelming. I'm excited that you'll have the opportunity to hear from some of them today. Unfortunately, there are many individuals from the service area who could not attend, but still deserve to be remembered. So just like Granny, I made you a photo book with the pictures of the people we met and the places that we saw during our outreach. The people in this book represent the essence of the Certificate of Need law. Just like Granny, I wrote a description for each one so you'd know who they are and why they matter. You'll meet older adults at a senior nutrition site. You'll meet paramedics who serve rural communities. You'll meet small business owners devastated by Helene. You'll meet volunteer firefighters who protect the most remote areas in our state. You'll also meet a gentleman named O'Neill Shelton from Madison County, who is one of the most dedicated champions for Advent Health's new hospital in Weaverville. I understand, I'll be very quick. He passed away earlier this month. Last thing he said was he wanted to share comments. You'll never have the privilege of meeting these wonderful people, but as Granny said, we love them, they matter, and they're worth remembering. Would you do me one favor before we end? If you're here to support Advent Health, would you stand so I can say thank you? I appreciate it more than you know. Thank you for making us part of your family. Thank you.
We'll hear from Mission.
Good morning. My name's Melina Arrowwood, and I'm the Chief Operating Officer at Mission Hospital. I'm joined here today by Dr. Shillinglaw and Dr. Colley. Before I begin, I would like to thank you, Ms. Lightbourne, for being here today, and thank each one of you for taking time out of your very busy schedules, especially during the holiday season, to support our healthcare systems across the region. I appreciate the opportunity to speak with you today about Mission Hospital's application for an additional 129 beds to meet the needs of Western North Carolina. Each morning, our leadership team begins by asking a question: why are we here? Our mission is clear. Above all else, we are committed to the care and improvement of human life. We don't just believe these words. We live them in every decision we make, in every patient we serve, and in every moment when someone in this region needs us most. I am an Asheville native. I didn't count the generations, I apologize, but I grew up here. Such a beautiful place to live and to raise a family. I am a nurse by training, and I have spent more than 18 years at Mission Hospital. I worked in almost every department in the facility, including the emergency department, where I started as a nursing assistant when I was in nursing school. And I learned some of the most important lessons of my life about humanity, vulnerability, and what it truly means to care for people in their most critical moments. I love our hospital. I believe deeply in the work that we do here and in the people who do it. Our physicians, our nurses, therapists, and staff who show up every day for our patients. Mission Hospital is the tertiary care center for the entire 18-county region of Western North Carolina. We provide services that are not available anywhere else in the region, including the only American College of Surgeons verified level 1 trauma center, a level 3 NICU, a children's hospital, a comprehensive stroke center, an advanced cardiology and surgery center, neurosurgery and neuro ICU, an outpatient burn center, CyberKnife, and many other specialized services. Mission also offers a full continuum of cancer and diagnostic treatment services through a comprehensive program affiliated with the nationally recognized Sarah Cannon Research Institute, services unmatched by any other provider in Western North Carolina. The 2025 State Medical Facilities Plan identified a need for an additional 129 acute care beds in Buncombe, Graham, Madison, and Yancey counties. It is critical to understand that not all acute care beds are the same. Patients cared for at a tertiary and trauma center like Mission require a significantly higher level of care than patients in community hospitals. Our beds are supported by specially trained physicians and surgeons, advanced practice providers, highly skilled nurses, advanced technology, and extensive ancillary services. Beds alone do not care for patients. It's the caregivers at the bedside and the environment and systems in which those beds exist that save lives. We are deeply committed to providing life-saving care for this community and the region. To do that, we are proposing to add 129 beds to Mission Hospital. Beds fully supported by the specialists, technology, and advanced services required to care for high acuity and complex patients. The need for additional capacity at Mission became clear following the pandemic and has continued to grow without relief. We have been requesting additional beds since 2022, and we will continue to advocate for every bed we need on behalf of the people of Western North Carolina. For several years now, Mission has been experiencing extremely high utilization of its acute care beds. In 2025, occupancy continued to climb, consistently exceeding 90%. For context, the state's target threshold to consider the need for additional beds is 78%. In contrast, hospitals across the region, including some that are represented here today, are operating at an average occupancy of approximately 35%. Collectively, those hospitals reported 628 licensed but underutilized beds in the 2025 license renewal applications. Those beds are not unused because patients do not need care. They are unused because patients need a different type of care, the high acuity specialized services that only Mission Hospital can provide. Hospitals throughout the region transfer patients to Mission every single day. We've heard that, because they do not have the clinical capabilities required to care for them. So far this year, Mission has accepted over 11,900 transfers of high acuity and complex patients from hospitals and providers across the region, including some systems represented here today. At the same time, we have been forced to decline more than 1,500 transfer requests this year solely due to lack of available beds, not staffed beds, physical beds. As a member of the executive team, I take a rotation as administrator on call. In that role, I work closely with the house supervisors to monitor the hospital capacity minute by minute and determine when we can no longer accept transfer requests because every bed is physically full. During those shifts, I receive calls from hospitals across the region asking for exceptions, whether or not we can accept their patients that they do not have the capability to care for, even when we're at capacity. These decisions are difficult and underscore the reality that Mission Hospital is often the last option for these highest acuity patients in Western North Carolina. When Mission must decline a transfer, that patient remains in an emergency department somewhere, sometimes for hours or days, while hospitals make additional calls trying to find a tertiary bed, often without success. And at the end of the day, no matter what happens in this process, Mission Hospital will always be asked to care for the sickest and most complex patients in our region. We humbly accept this responsibility, but we cannot fully do it without additional beds. Mission's utilization has been so high that over the past 2 years, we have received multiple emergency temporary approvals for additional beds under state law. Mission has been at or above 90% occupancy for more than half of the days in 2025, with many days exceeding 98%. This morning, just before coming here to speak with you, we were at 112% occupancy. While we are grateful for these temporary measures, they are not sustainable. The people of Western North Carolina need and deserve permanent beds at Mission Hospital. To meet the current demand, we have opened temporary patient care units throughout the hospital. While these beds serve a vital purpose, we are quite literally running out of space. Some of these temporary units rely on curtain partitions areas rather than private rooms, and some require shared bathrooms for multiple patients. The care remains exceptional, but the environment is not what our patients deserve. Approval of this CON would allow Mission to build permanent, state-of-the-art inpatient units with rooms, ensuring dignity, comfort, and the best possible patient experience. Mission Hospital is not alone in facing these challenges. High utilization at tertiary centers is occurring across North Carolina, driven by an aging population, higher acuity, and longer lengths of stay. Over the past 5 years, nearly every major academic and tertiary medical center in the state has demonstrated significant bed deficits, including over 500 beds with Atrium Health in Charlotte and Cabarrus, over 500 beds with Wake Med and Rex Hospitals in Raleigh, and almost 300 beds in Duke University Hospital. This is not a Buncombe County issue. It's a statewide reality, and when there are not enough high acuity beds to meet the needs, the patients are who suffer. Mission's role becomes even more critical during times of crisis. During Hurricane Helene, Mission Hospital served as the lifeline for Western North Carolina, treating more than 600 patients in our emergency department in the first 24 hours, double our typical daily volume, while cut off from power, communications, and municipal water. Mission never closed its doors. Caregivers worked around the clock while teams secured food, established satellite connectivity, dug wells to support hospital chillers, and coordinated tank operations delivering more than 300,000 gallons of water a day. Mission operated without municipal water for 54 days. Supported by HCA Healthcare's enterprise resources, helicopters delivered critical supplies, 300 relief nurses arrived from across the country, oxygen lounges were established for people in our community without power at home, staff were sheltered and supported, surgeries and delivers continued, and Mission never stopped accepting transfers from other community hospitals. That is who we are. That is what it means to live our mission. And that is why Mission Hospital must have the capacity to continue caring for those in the region today and for generations to come. I'm going to pass it over to Dr. Shillinglaw now, who's our medical director for trauma and critical care services.
Good morning. Thank you. As mentioned, I am Dr. William Shillinglaw. I am the trauma medical director, and I'm proud to announce that Mission Hospital has been recognized by the American College of Surgeons as a level 1 trauma center and the only such facility serving Western North Carolina. ACS verification represents a rigorous, independent, and unbiased standard achieved by the most advanced trauma centers in the United States and around the world. This designation reflects a trauma center's commitment to meeting the standards established by the American College of Surgeons Trauma Program Division and outlined in their resources for optimal care of the injured patient. These standards represent the highest level of trauma care and address essential principles related to resources, performance improvement, patient safety, care processes, data collection, protocols, research, education, and injury prevention. Of the more than 6,300 hospitals in the United States, only approximately 250 hospitals have achieved the ACS Level 1 verification. Level 1 trauma centers are recognized as the highest standard of trauma care. Their constant focus on performance improvement and evidence-based protocols has been shown to reduce potentially preventable deaths by more than 25 to 30%, compared with systems not operating on such rigorous independent standards. Mission Hospitals met these essential criteria, ensuring excellence in trauma care while also demonstrating a strong commitment to education and to advancing original research in trauma, emergency general surgery, and surgical critical care. This verification not only signifies Mission Hospital's critical role in delivering timely, coordinated trauma care, but also solidifies Mission's readiness to respond when the unthinkable happens. Families across Western North Carolina can take comfort in knowing that a world-class trauma care is available close to home. The milestone reflects the dedication, training, and compassion of every member of the Mission health team. The verification recognizes Mission's capability to provide comprehensive care for all aspects of injury, supported by around-the-clock surgical specialists, advanced technologies, and coordinated partnerships with emergency medical services throughout the region. The ACS Trauma Verification Reviews and Consultation Program helps hospitals evaluate and continuously improve care through an intensive process that includes on-site face-to-face review by a multidisciplinary team of trauma experts. This review addresses the available resources, performance across critical disciplines, including emergency medicine, emergent trauma and general surgery, neurosurgery, orthopedics, and surgical critical care. Achieving the ACS Level 1 verification is a tremendous accomplishment and a testament to the dedication of our entire team in meeting the growing needs of our region. This recognition reflects our unwavering commitment to Western North Carolina to provide the highest level of trauma care when minutes matter, rapid, organized care across the institution, from the emergency department to the operating room to the intensive care unit, saves lives and allows families to hold on to hope to see their loved ones return home for future holidays. Level 1 trauma centers are truly community assets, providing not only life-saving care, but also research, education, and injury prevention programs. Because I often say, the best trauma is the one that never happens. I could not be more proud of every individual in the Mission program who contributed to this success. The designation is particularly important to our region, which is an aging population. On average, our demographic is nearly a decade older than comparable regions. Older trauma patients are more likely to require neurosurgical care, complex orthopedic interventions, and intensive care resources than the younger multiple injured patient. Over the past 30 years, Mission's trauma program has consistently struggled with ICU capacity because of such throughput issues as outlined earlier. Largely, this is due to constraints with the physical environment. Today, the most effective way to meet the regional needs is by increasing step-down capacity, allowing patients to transition more efficiently from ICU, and freeing up critical beds for the next trauma patient or those requiring complex care such as interventional neuroradiology, cardiac surgery, or neurosurgical care. Expanding step-down level resources will effectively increase ICU capacity by improving transitions of care, ensuring that patients requiring surgical critical care and medical services can access them within Western North Carolina. This is the type of hospital capacity our region increasingly needs and deserves, and it represents the best use of these newly granted healthcare resources. This verification comes as we approach the 30-year anniversary of the Mission Health Trauma Program, which was established as a Level 2 trauma center nearly 3 decades ago. Today, Mission is an ACS-verified Level 1 trauma center, serving an 18-county region in Western North Carolina and one of only 7 level 1 trauma centers in our state. We are honored to serve the community, and Mission is uniquely positioned to meet the growing and complex needs of our region. We hope to continue expanding our ability to care for more patients and families when they need it most. Thank you very much.
Good morning. My name is Dr. Caroline Colley, and I am the System Medical Director for both Mission Hospital and Emergency Medicine for both Mission and all of our regional hospitals. So given my role, I'm actually keenly aware of the services and resources available at Mission Hospital and at all of our rural hospitals in the region. I also know that it's important for people to be able to receive care in their community when possible. In fact, I actually developed a telemedicine program that we run to support our hospitalists in the region and help keep patients closer to home when it's safe and it's possible. But I also know when a patient needs more advanced care than a smaller community hospital can provide. It is in these times when our hospitals in the region transfer patients to Mission. If a patient has a heart attack, an acute stroke, a GI bleed, or needs ICU care, that patient needs a tertiary care center like Mission. It is so difficult when my physicians in the region have patients that need to be transferred to Mission and Mission does not have a bed available. When this happens, patients and their families have to travel even further away for care out of Western North Carolina, which is extremely tough on them. As Melina said previously, Mission provides care that smaller community hospitals are just not able to provide. Just as we rely on our police, our firefighters, our EMS services, it is critical for our patients in the region to also be able to access Mission for advanced care when they need it the most. If our region faces another pandemic or Hurricane Helene, we need our tertiary system and our level 1 trauma center to have the capacity to handle this. Mission is committed to providing the highest quality of care possible. Multiple independent organizations place Mission Hospital in the top tier of quality providers in the nation. For the 10th consecutive year, Mission Hospital has been recognized as a HealthGrade's top 50 best hospital for 2025, putting us in the top 1% of hospitals in the nation. Mission Hospital was also recognized by HealthGrades as first in North Carolina for cardiology, critical care, gastrointestinal care, and gastrointestinal surgery. Mission Hospital has also been awarded the HealthGrades Patient Safety Excellence Award for 2022, 2023, 2024, and yes, 2025. Mission is proud to have recently earned its second Magnet designation, a prestigious designation that reflects nursing professionalism, teamwork, and the highest standards in patient care. Magnet status must be reevaluated and recertified every 4 years. This requires hospitals to demonstrate continued adherence to the highest standards and ongoing improvements in patient care and quality outcomes. Mission received its first Magnet designation in 2020, and now in 2025, the team again has proudly achieved this recertification. With this credential, HCA Healthcare's Mission Hospital remains part of an elite group. Fewer than 10% of hospitals in the United States have earned this designation, and Mission also is the only Magnet-recognized hospital in all of Western North Carolina. Mission's application is about providing life-saving care to everyone who needs it when they need it most. As physicians, we are committed to serving the people of Western North Carolina. We live here in this beautiful region. Our kids go to school here. We shop here. We seek our health care here. We are grateful to those of you who choose us for their care. And I promise we are committed to continuing to provide the highest level of care possible and urge the agency to allow Mission to fulfill our role by providing us with these beds. Sorry, I'm a little passionate about this. Mission is a gem and a critical resource in our community. On behalf of Mission Hospital, thank you for the opportunity to be here today.
Oh, yeah. Appreciate it. Okay, we'll begin calling members of the public. I'm going to try to call them based on who they support. So in other words, it'd be somebody from UNC, then Novant, then AVID, Michigan, etc. I'll try. So the first person I'm gonna call, let's see who has the golden ticket. Let's see. That would be Lisa Nanny.
It's fine.
Sorry.
Hi. Good morning. I'm Lisa Nanny. And I am here to strongly support the development of the UNC Health West Medical Center in Buncombe County. Because first, UNC Health is a nonprofit entity. I'm so sorry. UNC Health is a nonprofit entity that will dedicate all its practices and resources entirely to patient care, not profits, and only in this state and region, not spread across the nation or even internationally. Second, because UNC Health has the well-established extensive scope of specialties and levels of patient care necessary to serve this particular community's growing needs. And third, because UNC Health has a proven and unquestioned record of clinical excellence. I can attest to that level of excellence and range of care because I have experienced it for several decades now. During my years in college and graduate school, and for much of my career as a college professor, for over 20 years I lived in Chapel Hill and Durham and received my medical care from UNC hospitals and physicians. I've now lived in Asheville for nearly 20 years, and as a retiree, and I can attest to the immediate and increasing need for that same quality and scope of care in Buncombe County. When my husband and I chose Asheville as a place to live in retirement, one of the factors that influenced our decision was that Asheville had what was, at that time, a local, community-owned, patient-centered hospital that attracted and retained excellent medical care professionals. We found primary care physicians and specialists whose expertise and commitment to patient care we trusted. But in the past 6 years, after that hospital became a for-profit holding of an out-of-state conglomerate, almost all of our physicians and specialists have left mission practices and chosen to affiliate with UNC Health Part E to be able to sustain the level of care and accessibility to patients to which they are committed. My husband and I chose to remain patients of those physicians, and now we usually drive south to Fletcher or to Hendersonville to receive most of our health care with UNC Health Part E for routine, chronic, and acute needs. As we age, though, without a UNC hospital in Buncombe County, it will become harder and harder for us to be able to make that drive, to have the choice to remain patients of doctors committed to UNC Health standards, and to have acute care immediately accessible from our physicians. Like me, nearly 30% of the population of Buncombe County is over 60. To continue to attract retirees and other relocating people to this region, Buncombe County needs to invest in choices in medical facilities that offer a proven record of patient care and safety, administered by cutting-edge practitioners in a system that originated in this state, remains in this state, and whose sole focus is the needs of this specific community. UNC Health is that choice and the best choice.
Boltes, Boltes, Boltess. Boltes, B-O-L, or Bohes, B-O-H-E-S-S. I'm sorry. Oh, okay.
I've been called worse, don't worry. Hey everyone, good morning. My name is Bo Hess, and thank you for the opportunity to speak here today. I'm an Asheville City Council member, a licensed clinical social worker, and licensed addiction specialist who has spent my career working directly with patients, families, nurses, physicians, and healthcare systems across Western North Carolina. I'm here today to encourage approval of the Certificate of Need for Novant Health to build a community hospital in Buncombe County. Western North Carolina is growing, we're aging, and facing increasing healthcare demand, especially for acute care, emergency services, behavioral health coordination, and timely access to specialty care. At the same time, we know our healthcare workforce is stretched thin, and patients often face long waits or must travel outside the region to receive care. Novant Health brings experience, stability, and a proven community hospital model that can help meet those needs. Their proposed Asheville Medical Center would include 34 licensed acute care beds, an emergency department, imaging, pharmacy services, all designed to improve access and relieve pressure on our existing system. And importantly, Novant Health is a North Carolina-based nonprofit health system with a track record of partnering with local physicians, expanding urgent and specialty care, and making long-term investments in rural and regional healthcare infrastructure. Over the past year alone, they have expanded urgent care access in Asheville and Black Mountain and committed $20 million over 5 years towards strengthening rural primary care in Western North Carolina. From my perspective as a clinician, competition matters. Thoughtful competition improves patient choice, encourages innovation, and helps healthcare systems attract and retain skilled professionals. When providers have real options, when providers have real options for where to work, it strengthens wages, working conditions, and care quality for nurses, social workers, case managers, technicians, and physicians alike. From my perspective as a city leader, this proposal represents responsible growth, expanding access to care close to home, creating good paying jobs, and adding resilience to our regional healthcare network. In conclusion, Novant Health is the kind of healthcare neighbor Asheville and Western North Carolina need. Committed to community partnership, workforce investment, and patient-centered care. And for these reasons, I respectfully urge you to approve their Certificate of Need for Novant Health. Thank you so much for your time and consideration.
Jim Callister.
Good morning. My name is Jim McAllister. I'm the mayor of Woodfin, North Carolina. We're the first little town that abuts Asheville on the north side. We're a town of about 8,300 people, and our town council voted unanimously after much study and discussion to support Advent Health's efforts to operate a regional medical facility in nearby Weaverville. They know that I'm here today, and they hope that you will hear our concerns and hopes for Advent Hospital. I have to be honest, in terms of these additional beds, my town finds it hard to believe that Mission is actually being considered. Folks in Woodfin keep reading and hearing the horror stories about what is happening at Mission. You combine that with the reports that oversight agencies keep doing to warn Mission about its many failures. It makes us wonder how they can actually be in consideration. I'm sure that the other applicants for these beds are worthy, great organizations, but adding this capacity to the already approved beds at Advent will allow this company to build a regional medical center, not just have some more hospital beds available. Spreading these beds around the area will simply confuse people and perhaps doctors as well. Giving these beds to a company other than Advent will simply create a system of small hospitals feeding the Mission machine. We hope and ask that you award these beds to Advent to give people the confidence that they have another choice, one that doesn't require them to drive to Wake Forest, Durham, or even Atlanta. Advent has proven its worth, having purchased its Weaverville site and begun construction, both huge investments in our local communities. It's moved forward despite being challenged repeatedly by HCA's army of lawyers. I appreciate the ability to be here and to share our concerns with my town. We're counting on you to do the right thing. Thank you.
Dorinda Spade.
Hello, my name is Dorinda Spade, and I am here as an advocate for Mission Hospital. 3 months ago, I was brought low by some pea gravel and acorns in my backyard, and I suffered a complicated broken ankle, which required multiple surgeries to correct. And I was at the regional hospital in Franklin, and then I was sent to Mission to receive more specialized care and surgeries because I had several broken bones, torn ligaments. I now have bolts, screws, plates, and metal in my ankle. And all I can say is that I am a walking testament for the care from Mission. I have no pain. I am walking with my normal gait. I received excellent care while I was there. And every person from the intake office at the front desk through the surgeons who took care of me, the nurses who were compassionate and made me as comfortable as I possibly could be because I was in a lot of pain. They all treated me with the utmost kindness, respect, and professionalism. So all I can say is that I am extremely grateful that a hospital with the standards of Mission is available and within my reach in rural North Carolina. Thank you very much for your time and your consideration, and I hope that you will consider Mission in your evaluations.
Mess up somebody's name. My apologies. Jerry Vahorn.
Good morning. My name is Jerry V. Hahn. I'm a retired emergency services director for Buncombe County, which is a position I held for 47 years. I was also the mayor of Woodfin for 20 years, was there right before Mayor McAllister, who just heard from speak. Anyway, I'm here today to support the hospital and the facility, which hopefully is going to be in Weaverville. And the reason I say Weaverville, and that's Advent, is you know, if you live in Madison County, it's a long way to Mission Hospital. If you live in Yancey County, it's a long way to Mission Hospital. By putting a hospital in Weaverville, you're halfway there. You have a lot of services that you otherwise wouldn't have. And I encourage the approval of that facility. And I noticed an article on WLOS News last night where we may be halfway there. And anyway, hopefully we'll see a new hospital very shortly in the north end of the county. When I was growing up, and I was a native of Woodfin, by the way, we had 3 hospitals. We had Mission Hospital, St. Joseph Hospital, and Aston Park Hospital. Now we only have one, and not to make light of what Mission Hospital has to offer, but competition is always good for any business or any other operation. As far as the beds, I think we might as well approve the beds all at one time. Make it a one, when you start this hospital and you start construction, let them finish it. Let them make it something we're all proud of. For many years, I've heard people hope for a hospital in northern Buncombe County, particularly people from Madison County. Yancey is another area. You got, even in Buncombe County, you got areas like Barnardsville, which is a pretty good ways from Mission Hospital. Look at the population growth in the area. Look how the north end is growing. It's trying to rival, I think, the south end of Buncombe now. But anyway, a lot of apartment buildings, a lot of new home construction, and certainly something that's needed. One thing that I will mention, one last thing. How many of you have heard people say, particularly from Madison and Yancey County, so-and-so in my family had a heart attack and they died en route to the hospital? Would that have happened if we had had a hospital halfway there? You never know about these things, but you certainly have to think about them. And I would encourage the adoption of what Novant is asking for the beds. Go ahead and let them have them, approve them. We don't need any more bureaucracy than we already have. So in closing, let's all get on board. Let's support our hospitals, and let's make patient care something that's available efficiently, locally, and very fast to everyone who needs it. Thank you.
Louis Bissett. Oh, you're right. Sorry.
Thank you and good morning. I think it's still morning. My name is Lou Bissett, and I want to thank the UNC Health leadership for being here this morning to discuss the UNC West project and their continuing commitment that they've already demonstrated many times to Western North Carolina. I've worked in Western North Carolina and the Asheville community for over 50 years, serving as Asheville's mayor in the 1980s and on various boards, including those of UNC Asheville, Western Carolina University, the Asheville Chamber, Mission St. Joseph's Hospital back in the day, Western Carolina Industries, MAHEC, and the UNC System Board of Governors for over a decade, including serving as its chair from 2015 to 2018. Those experiences have given me a deep familiarity with the culture of Asheville and Buncombe County, as well as the diverse communities across Western North Carolina. My experience in this region, combined with my work with UNC, has convinced me that there is no better provider to establish a new hospital campus in Buncombe County than UNC Health. In partnership with UNC Health Part E, UNC Health's proposed new hospital, UNC Health West, will greatly expand access to healthcare resources in our community and ensure that one of our state's premier healthcare providers can expand its care in Western North Carolina. As those of us who live here now know, Buncombe County is both growing and aging. particularly within the last decade. As the largest population center in Western North Carolina, it just isn't viable for such a growing community to have only one existing hospital provider. And when you consider that so many people travel to the Asheville area for numerous reasons, including health care, it makes sense that an additional hospital provider will ensure that patients from across our region can have another excellent, accessible option for hospital services. UNC Health has significant experience with both establishing new hospitals and providing hospital-based care in Western North Carolina. In addition to the incredible care provided at UNC Health Part E in Henderson County, UNC Health operates 4 other hospitals in the Blue Ridge region, which are premier providers of care to the communities they serve. But UNC Health's familiarity with Western North Carolina goes even further. They proudly operate numerous primary care practices across our region, including 5 right here in Buncombe County. In other words, UNC Health is already an active provider within our community. The development of a UNC Health hospital would only deepen this community involvement. Our community needs another hospital provider. I think we all recognize that. I hope that as the agency reviews this application, you'll see what I've seen firsthand, that UNC Health has the experience and high quality of care to provide the services that our community needs and deserves. I strongly support the development of UNC Health West in Buncombe County. Thank you very much.
Michael Messina.
Morning. My name is Michael Messino. I am now retired, but have been in this community since July of 1990. My area of practice was general oncology, but I had a specialty in high-risk hematology, such as acute leukemia, which I treated in the past for all modalities, including bone marrow transplantation. Most people knew the practice when it changed its name in 1994 to Cancer Care of Western North Carolina. In January of 2020, the cancer center was named after me, Messino Cancer Centers. That wasn't my choice. Over the years, the practice grew to 14 oncologists, 18 advanced practitioners. Among these practitioners were medical oncologists with extensive experience treating acute leukemia, which is going to be my main comments today. Over the time, the practice expanded to 5 outreach clinics, the first being in Silva in 91, the last in Marion in 2015. We were able to see patients from all 18 counties, and we had a strong inpatient service treating acute leukemia and high-risk hematology patients with lymphomas and central nervous system lymphoma. This kind of therapy required coordination with many people, including oncology pharmacists, well-established nurses that were specialized in hematology, and advanced practitioners which were able to help in the care of these sometimes very seriously ill patients. We were able to keep people in Western North Carolina not traveling to larger programs, which would usually be a university. The peak of the practice was in the years between 2010 and 2017. During the time, we were in a professional services agreement with Mission Hospital. Coordination with the hospital and all the services available at the hospital allowed us to care for these critically ill patients. In September of 2023, members of Messino Cancer Centers made the decision that it was too risky to continue to treat acute leukemia patients or high-risk hematology patients at Mission Hospital. The reason for this change was the hospital's support necessary to do this was no longer present. This decision required patients to travel to Winston-Salem, Charlotte, Durham, Chapel Hill, or to west to Tennessee or south to Greenville, South Carolina. Although this did not constitute many patients, clearly these patients who needed this kind of care were seriously compromised. At this time, I'm supporting the desire of Novant Health to build a hospital that will be both a general hospital, but also bring back the kind of oncology care that this community has had in the past. This will require a commitment. Currently, Novant is doing this in hospitals in Charlotte, Winston-Salem, and Wilmington. My hope is that this kind of care that was present here for many years can be resumed in Western North Carolina to help these patients to remain close to home for these intense treatments and to receive the care that they have grown to know. Yes, much of oncology and hematology is becoming more outpatient, but there is this group of patients that require intense inpatient care. Advancements are important, and we are able to continue these treatments with the support of the administration and the hospital system that is committed to this kind of care. I treated my first leukemic patient in September of 1990. Now these patients have to travel outside of this area. It seems like a step backwards rather than a step forward for this community. Thank you.
Derek Lawrence.
Good almost afternoon. As the new mayor of Weaverville, I'm here today to speak in support of the Advent Health proposal to expand acute care capacity in Buncombe County. Their change in scope, developing 129 additional acute care beds for a total of 222, represents a significant investment in the health and well-being of our region. This project is targeted for completion in 2030, and its impact will be felt for decades to come. This expansion is not just about numbers, it's about people. It's about serving an area that has long been underserved, reaching towns and counties surrounding Buncombe County, including Weaverville. By locating this facility near major traffic arteries, Advent Health is ensuring that residents who need immediate attention will spend less time on the road and more time receiving the care that they deserve. For families in geographically challenged areas, this hospital will be more than a building. It will be a lifeline. It will mean shorter travel times, faster access to acute care, and greater peace of mind for those who worry about emergencies far from home. As the newly elected mayor, I continue to support these facilities because they are clearly focused on the benefit of our residents and neighbors. This is about stewardship, about making sure that Weaverville and our neighbors have the health care infrastructure to meet today's needs and tomorrow's challenges. It is about building a legacy of accessibility, resilience, and compassion. I want to thank Advent Health and all the applicants for their commitment to serving our community, and I want to thank the people of Weaverville for reminding us that healthcare is not a privilege. It is a promise that we make to each other. Together, we can ensure that Buncombe County and Weaverville are places where health and hope are always within reach. Thank you very much.
Larry Harris.
Thank you. My name's Larry Harris, and I'm a resident of the town of Black Mountain and have served in an elected capacity as mayor and council member in Black Mountain, and over the past 40 years in numerous not-for-profit volunteer roles in the county. I currently serve on the local board of Mission Hospital as a local community member, board member. It's a non-paid position. It's a volunteer position. And I'm here this morning to be an advocate for the beds, the 129 acute care beds being awarded to Mission Hospital. I suspect everyone in the room understands the complexity of healthcare and the complexity of how it's delivered. And in certain states like North Carolina, the complexity at which hospitals can expand, various services can expand, and it's just not a simple process to work with, not a simple one to easily discuss and summarize. But one thing we do know, which has already been expressed by the executives and the caregivers at Mission Hospital, Dr. Colley and Dr. Shillinglaw, and our other fine systems that are looking to be awarded those beds, is that Mission Hospital is a tertiary care hospital for Western North Carolina. Mission Hospital, as has been said, is the med surge and step down beds average over 90% occupancy on a given morning. That has been said more than 100%. And my simple perspective is that for the well-being of not only the citizens in Buncombe County, but for the well-being of the citizens, in the westernmost counties of North Carolina, the immediate need is for additional beds at Mission Hospital. For the future, I'll leave that to the future, but the immediate need is more beds at Mission Hospital where these significant complex services are delivered and where the caregivers at Mission Hospital care for an immense load of Medicaid and Medicare patients across Western North Carolina. And as you have heard, the hospital is simply in dire needs of additional beds for a variety of purposes, for additional step-down beds, and to help patients more appropriately move through the continuum of care, to free up ICU beds for patients needing these critical levels of care. So again, I speak on behalf of Mission Hospital, the caregivers, and the people of Western North Carolina and their immediate needs, and it is for more beds at Mission Hospital. Thank you.
This is somebody that supports 3 hospitals. So John Nicolay.
Good morning. My name is John Nicolay. My wife and I reside in Asheville. Ms. Lightborn and DHHS, my words are directed to you, and Godspeed to you in your efforts. Your decision in this matter is of vital importance to the people of Western North Carolina. To get to the point, my wife and I overriding opinion is that could be anybody but HCA. The HCA business model puts profit ahead of patient care by understaffing Mission and foregoing other investments in safe, high-quality care. Ironically, HCA, with nearly 200 hospitals, has the financial resources and expertise to transform Mission into the excellent regional hospital that nearly 1 million residents in Western North Carolina desperately need. However, since its acquisition of Mission, HCA has chosen to degrade rather than improve the patient care at Mission in order to achieve its profitability goals. I firmly believe HCA knows what needs to be done, but first they must choose to do better. Add to that the repeated findings of immediate jeopardy since the acquisition that prove that HCA's business model has cost lives and put patients at risk. For that reason alone, it is imperative that DHHS select one of the other healthcare systems to build and operate these 129 beds. HCA can't staff and manage the beds they have. For several years, the regional community has demanded that HCA literally sell Mission to a strong nonprofit healthcare system willing to provide the level of care that this region needs. HCA has made it clear they're not interested in selling. So the next best available solution is competition. We've heard that word several times today. Give the strong-minded people of Western North Carolina the choice in our healthcare, and we will vote with our feet. That leaves UNC, Novant, and Advent competing for these 129 beds. So, DHHS, as you look among the three candidates for the award of these beds, we ask that you include the following criteria. Number one, a consistent 5-star rating in their hospitals among both patient and overall ratings. Number two, no history of immediate jeopardy. Number three, a reputation as a desirable place to work among professionals and staff with documented low turnover. A documented history of providing sufficient staffing levels to ensure quality of care among all lines of business and all disciplines. A cultural bias toward the community and the voice of the customer. A CEO would choose to be accountable to the community, engage with the community, and face the community in good times and bad, and not think that a TV ad or a billboard would build trust in spite of documented failures. A consistent record of quality performance and responsible working relationships with all regulatory bodies. Number 8, the verified financial strength and capability to fund their specific proposed program of work. And finally, number 9, a well-documented plan and commitment for the immediate start of this project, of their project, and the fastest possible delivery of that completed facility ready to receive and serve patients. The people of Western North Carolina are counting on you, DHHS, to make the best decision in your wisdom possible to improve access to quality health care in our region. And Ms. Lightbourne, I'll make an observation. I can't tell you how many times I've been in this very room on this very subject. I feel more optimistic today than I have in 3 or 4 years. This may be a turning point. This may be the beginning of the end of a big problem in Western North Carolina. Thank you for your good work. Thank you for your time.
William Lapsley.
Good morning, excuse me. Good morning, ladies and gentlemen, and thank you to the state of North Carolina for the opportunity to speak this morning. It may be this afternoon. I haven't looked at my watch, but it is grateful for the opportunity to speak on support of the CON application from UNC Healthcare and Pardee Hospital. My name is William Lapsley. I'm a resident of Henderson County now for over 50 years and currently serve my community as the chairman of the Henderson County Board of County Commissioners. I'm in my third four-year term as an elected official, and I have 1 year to go before that is done. I've also had the honor of serving as a past chairman of the board of directors of the Henderson County Hospital Corporation, more commonly known as Pardee Hospital. I was directly involved in the establishment of a partnership between Pardee Hospital and UNC Healthcare in 2010. Please note that the county did not sell its hospital, unlike the previous speaker mentioned for my friends in Buncombe County. It established an operating partnership with UNC Healthcare. And that agreement has now been implemented for over 15 years. The partnership has a clear track record of successes, which I'm very proud of. No need to get into the details at this hearing, but those accomplishments are well documented. I'm also honored to have served a 6-year term on the UNC Healthcare Board of Directors during the same period of time. Our county-owned hospital has consistently grown along with our population in Henderson County over these many years. We've expanded access to high acuity services and attracted many new patients from beyond our county border, including from our neighbors here in Buncombe County. Our citizens have strongly supported each step of the expansion of services at Pardee Hospital. This fact is supported by the recent reporting of patient satisfactory surveys, as you've heard earlier, that has ranked UNC Pardee among the top hospitals in the state of North Carolina. And we're also very proud of that accomplishment. As we all know, Buncombe County is the hub of Western North Carolina in many economic areas, including healthcare services. Access to vital care and specialty services has and will continue to center around Asheville. The need for additional acute care hospital services in Buncombe County is obviously very clear. The question is, which organization of those that have applied, and they're all very good, as have been stated, which organization is the best suited to meet this need? I would submit to you that UNC Healthcare is clearly the one ready to step up and meet the challenge. UNC Health has a proven track record of clinical excellence and quality care right here next door in Henderson County. This is a clear demonstration of UNC Health's commitment to delivering the highest quality of care in our region right now. UNC Health, as has been stated earlier, has 22 clinical locations in Western North Carolina, including 5 primary care practices here in Buncombe County. UNC Health is also operates, as has been mentioned, the Mountain Area Health Education Center, MAHEC, for us locals. That is a direct tie to the UNC Medical School in Chapel Hill, something which our region is very proud of. UNC Pardee is ready and willing to step up and help our neighbors bring an existing partnership from your friends in Henderson County next door. UNC Health is not an out-of-state or out-of-area operation. It's local as far as we are concerned. It has been growing from its headquarters in Chapel Hill around the state for the past 25 years. The partnership with Pardee Hospital is just one of many that it has done with other county-owned hospitals around our state of North Carolina. The board of directors of UNC Pardee has agreed to share its local leadership structure with our friends in Buncombe County to make this new facility an asset to both Buncombe, and Henderson County. I'd like the record of this hearing to show that I fully support the development of UNC Health West and urge the state of North Carolina to approve their CON application for this project. Thank you, ma'am.
Wendy Blankenship.
Good afternoon. My name is Wendy Blankenship, and I'm grateful for the chance to share why I support Novant Health's application for a 34-bed hospital in Asheville. My message is simple. I want Novant Health as my neighbor because the community deserves remarkable care. I've lived in this community my whole life. We were once known for great coordinated health care, but that's not reality anymore. And I experienced that firsthand. Last spring, I received my first abnormal mammogram. Because results are now released to patients and doctors at the same time via their portal, I learned of my results on Friday before I could speak with a doctor to understand the next steps. That started 2 weeks of anxiety as I waited for a referral. I even tried to call and self-schedule my ultrasound. To this day, I still haven't heard from that provider about a referral or scheduling my follow-up. Thankfully, through personal connections, Novant Health's Dr. Bird stepped in to get my ultrasound scheduled. I wasn't even his patient, but he went above and beyond to make sure I received the follow-up care I needed. I'm grateful my journey ended there with normal findings, but still I experienced 2 weeks of worry and no answer. If it wasn't for Dr. Bird, I still would be waiting. That's why I want Novant Health as my neighbor. I've experienced Novant's doctors going above and beyond, and I know the care will translate in their hospital. During Hurricane Helene, my friend in Swannanoa was devastated. She needed ostomy supplies and could not get shipments in. I once again reached out to Dr. Bird to see how we could get this handled. He didn't just give me advice. He got her phone number, gathered supplies, and met her in person with what she needed. That's the kind of care you get from Novant. That's the neighbor that I want. This community deserves better. We deserve a hospital where care is coordinated and where passion drives action. Novant Health can bring that to Asheville. I urge you to approve Novant's application for this hospital. Thank you.
Keith Maxwell.
Thank you, madam, for coming all the way from down east to put us together today and put this hearing on. My name's Keith Maxwell. I'm a native of Western North Carolina, 7 generations. I grew up in Henderson County. My mom's folks are from Spring Creek in Madison County. I came back to Asheville in 1988 and was the first fellowship-trained spine surgeon in Western North Carolina between Charlotte and Knoxville. I'm the president and founder of Southeastern Sports Medicine. And over the years, I had privileges for 21 years at Mission Hospital HCA, 42 years of privileges at Advent Hospital, 10 years of privileges at St. Luke's in Tryon, and over 15 years of service privileges at the VA Medical Center. Saw Mr. Vion here. I was in the second class of EMTs in 1975 at AB Tech when I was in college. And he offered me a job to drive an ambulance for $2.45 an hour. Believe it or not, in those days, the ambulance service in Buncombe County consisted of the funeral home's hearse and a bottle of oxygen. And the first graduates of the MT courses, not all of them made the cut, but Some of the first ones they had were folks who drove the ambulances with a ball of oxygen. So we came a long way. I can remember the days when I worked in the ER at Mission Hospital in the early 70s. You didn't have an ER doctor in the hospital. If you were in a wreck and had 2 open femurs, they might get a guy who just finished delivering a baby to come downstairs and see what he could do. So I'm not as old as some, but I'm pretty dang old. And I've seen a lot of changes. And I could write you a book. In the early days, 95% of my patients, which I tracked the data, chose to go to St. Joseph's over Mission. I gave them the choice. I had practice at both places, and they chose St. Joe's. They loved a kind, loving, compassionate atmosphere for healing. And that is important to the people in Western North Carolina. At least that's been my experience. I've had the horrible experience to sit in my clinic and talk to patients, and they go, "You operated HCA?" And I go, "No, I'm sorry, I don't anymore." Well, good, because if you did, I was telling you, I will not let you do my surgery, and I won't have it done by you. I'll find somebody that will operate somewhere else. I've had patients in my office who've signed out AMA from HCA. What we hear in here about how great everything is, when you talk to those on the street and really know, it's been an impact to our community. As somebody who's been on ER call, who on some nights have had to make 7 calls to try to transfer a patient anywhere from the University of Virginia to Medical College of Georgia, because 10 years ago, that patient would have been taken care of at Mission, and we could count on that. But that topography has changed, and that's all I'm going to say about that. The other thing, there's things that concern me here. I've worked at virtually all the hospitals in the area. You know, when you have a hospital that's continually funded off the taxpayers' back, you know, our tax money goes into North Carolina. We can look at UNC and take a look at their financial history and the money they've lost in operations over the last 10 years. Take a look at Part E when they've had to operate in negative budgets, in the red. You know, we have a saying in Advent, without a margin, you can't have a mission. You have to have prudent management of hospital systems that can be sustained and last over time. Advent has been in this community over 100 years. I was born there, believe it or not, 70 years ago. And I've seen how it has stood faithfully in the community. And I had the experience of 5 years ago, I got hit by a car riding my bike. And I'm thinking, God almighty, am I finally going to get my turn to ride in a helicopter? Well, the fact is, not all of us need helicopter rides to the hospital. Only a very small percentage of our healthcare dollars goes to each one of us needing that incredible trauma response in a quick moment. Most of us simply need our gallbladder taken out, or our prostate gland trimmed, or total knee done, or a hysterectomy. Community service surgeries and care. And the people on the north end have been neglected my entire practice. I have made a living seeing folks from Mitchell County, Yancey County, used to see folks from Avery County, certainly Madison. They have not had a choice. They have had to just take the skimmings off of what was left. We need a hospital that provides community care in that corridor. And we have folks that'll come from Irwin, Tennessee, this side of Johnson City, that will seek care there. But as one of the other speakers said, you know, it's a halfway point. Mission does a great job with their high complexity level, but not everybody needs it. And we have to look at where it's the best place to spend the healthcare dollars. Let's put it in a place where we can serve the people who are using routine elective care every day. We don't need to spend every dime we've got on an emergency that may or may not happen to you in your lifetime. And furthermore, I'm advocating for Advent. I have seen the 10-year plan For healthcare in Western North Carolina, Advent is committed to spending $800 million in Western North Carolina over the next 10 years. They're stable financially, they're stable from an organizational standpoint, and they will be a rock in the community that will be there 100 years from now in Weaverville. Thank you.
Alex Glover.
Good now afternoon and good ready Merry Christmas. Not too long from now. I'm Alex Glover and I'm chairman of the board of trustees at Blue Ridge Regional Hospital, a mission facility, and I'm not an employee, I'm a volunteer. I'm writing in support of Mission Hospital Certification of Need application to expand beds at the main hospital campus. The expansion is critical for Mission Hospital to continue to meet the need for the complex and advanced inpatient services for residents of the entire Western North Carolina region, including my Blue Ridge Regional Hospital in Spruce Pine. The Carolina region who rely on Mission, as many low acuity healthcare services have shifted to settings outside of traditional hospital walls, the role of larger tertiary centers such as Mission Hospital has become more pronounced. The increased shift to outpatient services, along with the rising cost of care and shortage of advanced specialty providers, has made it prohibitive for smaller hospitals in the region to provide specialized care services. As a result, they depend on Mission as the region's tertiary medical center to provide trauma care, complex medical surgical services, and special pediatric care. For these reasons, the extraordinary demand for Mission Hospital services in Buncombe County and the surrounding region actually generated the need for additional hospital beds. The need is further exacerbated by the fact that our community is experiencing a growing aging population, a larger number of people care at hospitals that provide access advanced surgical and medical specialists and more complex care like that available at Mission Hospital. Given the critical role that Mission plays in providing higher level care to the entire Western North Carolina region, I'm very concerned about the critically high utilization of ICU and medical surgical beds at Mission and what this means in terms of availability of advanced care when patients need it. The expansion of beds at Mission Hospital should only be viewed as ensuring that essential life-saving care continues to be accessible in Western North Carolina. It is clear that approval of Mission Hospital's application to expand beds is needed to continue to be able to provide services critically needed by residents of Buncombe County, Graham, Madison, and Yancey counties, as well as the Western North Carolina region that relies on Mission in their tertiary care. To deny this proposal will mean continued pressure on the essential provider to meet growing need for the high acuity care in the region. Just imagine the scenario of your child or grandchild being critically injured in Western North Carolina in a Western North Carolina accident, and the only tertiary trauma center capable of providing treatment for these injuries is not available due to being at capacity. And that's what our situation is now. Thank you.
Al Platt.
Thanks you. Thanks to the state of North Carolina. Thanks for conducting this event. Welcome and hello, you all. My name is Al Platt. I live in Brevard. I think I'm the first speaker southwest of the geography of all of the rest of you, and I'm happy to be here representing the western mountains. I am not a medical professional. I'm an architect. I have been practicing in Transylvania County for 50 years. I am the husband of a now deceased city councilwoman. I am the father of a recently honored North Carolina award winner. And I am the partner and son or father of a passionate perpetual member of the Boys and Girls Club, now named for his mother, his late mother. So community is in the air of Transylvania County, in the circle of my family and our friends. And about 5 years ago, at the beginning of sometime during the pandemic, a former client asked me if I would have lunch with him and Mr. Kirby in Hendersonville, who wanted to talk to someone or some others from Transylvania County about the prospect of performing services or beginning to provide services in Transylvania County, and wondered how that would be received by the community. Wanted an opinion from me about that, which I gave him. And I realized when Mark Weinstein, the head of Brevard Music Center, who asked me to come over here and do this, asked me to do this, my first thought is that we are pretty well served in Transylvania County at the level of clinics and doctors' offices and the like. And it's largely due to the effort and the performance of Blue Ridge, UNC Health and Part E, who are not, who actually perform community service, quietly and powerfully provided a refuge for the evacuation of Transylvania County's medical profession when the little hospital we have belonged to the big hospital you had, and then all of it suddenly belonged to a for-profit corporation. So I envy those of you in southern Buncombe County who have the opportunity to have this facility developed in your neighborhood, if it happens, or any of you anywhere, because it'll be real. It'll attract good professionals. All the fundamentals are there. It's nonprofit. It's North Carolina, and I'm fully in support of the application of Part E. Thank you.
Glitzman. Yes.
Good afternoon, everybody. My name is Sharon Glicksman. I live here in Asheville, North Carolina. I'm here today to support Novant Health's application for the 34-bed hospital in Buncombe County. In addition to being an Asheville resident, I'm also a Novant Health patient. My journey started in Winston-Salem between Christmas and New Year's of 2022. I slipped on the ice going to the gym. By mid-January, I just wasn't feeling right. My head, my back, it all felt off. I reached out to doctors and eventually saw Dr. Potts at Piedmont Ear, Nose, and Throat Associates, and he discovered that my tonsils were 4 times the size and insisted that they be removed. 5 days later, on Valentine's Day, he told me something no one ever wanted to hear. I had cancer. In that moment, I had no idea what to do, but he and other subsequent doctors I met at Novant Health sure did. Dr. Potts immediately connected me with oncology and radiology, Dr. Jacks and Dr. Reardon, and a nurse navigator who became my lifeline. Living alone in Winston-Salem, that navigator laid out everything. Dietitian, therapist, counselors, integrative medicine. They gave me a roadmap when I was lost. My treatment was intense. I had 6 rounds of chemo, 33 radiation sessions, and fed myself through a feeding tube for 32 days to have my health. Every step of the way, the care teams at Novant Health were there. They taught me how to feed myself. They sat with me during radiation and supported me during the hardest days. After radiation, I'd sit in the machine and actually practice yoga breathing, because healing isn't just physical, y'all, it's holistic. I had incredible support from my family, my son, lifelong friends, soul sisters, the company I was working for. My closest girlfriends even rented a home nearby so someone could be with me every single moment through treatment. Novant Health was my neighbor in Winston-Salem. They gave me the gold standard of treatment of care, and 6 months later, I'm proud to say I am cancer-free. Thank you. I live in Asheville today. I still drive back and forth to Winston every 6 months for follow-up. And every time I drive there, I think to myself, I want Novant Health to be my neighbor here in Asheville, because having choices matters, especially for people new to the area or those who hear the words, "You have cancer," and don't know where to turn. Having someone to hold your hand, navigate appointments, and offer integrated care is life-changing. That's why I want Novant Health to be part of Asheville, so others can receive the same remarkable care and have the same hope and healing I did. Today, I use my voice stronger than ever to advocate for our community and for Novant Health, and also to bring the principles of yoga and breath into the corporate space so we can all learn to grow and thrive. Thank you.
Shane Hillard.
Good evening. I'm Shane Hilliard, Sheriff of Yancey County. My deputies and I are with people on some of the worst days of their lives: serious accidents, medical emergencies, and critical situations. In those moments, having access to strong emergency and trauma care matters. For the people of Yancey County, having those services available with a closer drive makes a real difference for families who are already dealing with stress and uncertainty. What stands out to me is the relationship Advent Health has built with our community. From the very beginning, they've been sure community members, local leaders, and first responders had a seat at the table. We weren't brought in after the decisions were made. We were included in those decisions, and they listened to us. That kind of communication matters. Advent Health has proven to be a strong community partner before the hurricane, during the hurricane, and after the hurricane, showing up, supporting first responders, and standing with our citizens when it mattered the most. I support this request because I've seen what partnership looks like when it's done right. Strong emergency and trauma care combined with closer options for our residents makes our region safer and better prepared. Advent Health has earned that trust, and I believe it's the right step forward for the people of Yancey County. Thank you.
Christy Bryant.
Good afternoon. My name is Christy Bryant, and I serve as the EMS Director for Yancey County. I appreciate the opportunity to speak today on behalf of Yancey EMS and the citizens of Yancey County. and strong support of Advent Health being awarded the additional 129 beds identified by the state as a need for our region. Yancey County does not have a hospital within its borders. Our citizens depend heavily on facilities in surrounding areas, and the proposed Advent Health Hospital in Weaverville would be a tremendous benefit to our community. It would shorten transport times, improve access to specialty care, and provide an alternative to the Mission Health System, a system that frankly has not served our rural residents well. I spoke at the last hearing in support of Advent Health, and I was grateful that the state recognized the need and awarded those beds to them. However, Mission Health has since tied that process up in litigation, delaying a project that would directly improve patient care and save lives. Our hospital in Weaverville would have been open by now if it weren't tied up in an unnecessary litigation process. Mission claims to be for the people and committed to their health care needs, but it seems that the commitment only applies when the revenue flows back to them. In a meeting in October, Greg Lowe from Mission Health stated that Advent sends 12 patients a day to Mission. I'd ask, has anyone stopped to think that many of those patients didn't want to go to Mission in the first place? We see this every single day in Yancey County. We have patients who need advanced services like orthopedic surgery, cardiology, or emergency surgical care, services not available at Blue Ridge Regional Hospital, and they tell us, take me anywhere but Mission. Some even choose to go out of state to Johnson City just to avoid Mission Health altogether. That should tell you something. Don't misunderstand me. We are grateful to have Blue Ridge Regional Hospital just over the county line, but their capabilities are limited. Even more concerning, our local Blue Ridge Medical Center in Yancey County, once fully staffed with multiple primary care providers, now has only one primary care provider left. One. That facility used to serve as a vital source of ongoing care for our residents, but since HCA's takeover, we've watched provider after provider leave. When a community loses access to primary care, it creates a ripple effect. Patients go without preventative care, chronic conditions worsen, and ultimately, the burden shifts to EMS and emergency departments. Our citizens deserve access to a regional hospital that provides high quality, compassionate care, and that's what Advent Health has demonstrated time and time again. Years ago, we were able to receive continuing education from Mission's NICU team for our neonatal resuscitation certificate. Since HCA's takeover, that program has been stopped. Mission now refuses to allow their NICU nurses to come into rural communities like ours to teach these life-saving skills. Why would a system that claims to be for the people block training for rural first responders in a county without a hospital, where the nearest OB center can be an hour or more away? Luckily, Johnson City Medical Center stepped in and provided that education for our teams. Just in time, too, because we utilized those skills on October 11th with the assistance of a healthy baby girl that was delivered in the field in Bald Mountain, which is about a 50-minute transport to Mission, as hard as you can go. I've also experienced Mission Health personally. I was admitted twice this year, once to outpatient labor and delivery, and again to deliver my child. Let me be clear, my nurses were wonderful. Every single one, from L&D to pre-op to post-op, mother-baby, was kind, professional, and compassionate. But it was disheartening to hear that Mission cannot open their state-of-the-art outpatient L&D space because they simply can't staff it. My nurse explained they remained in the older space because the new area is 2 floors away from the main labor and delivery. And if a delivery happens, they must run over to help. They stay in the old space so they can just run across the hall. That is not an operational plan, that's a staffing crisis. Mr. Lowe has said that Mission takes care of the sickest of the sick, and asked where else can these patients go to receive the level of care that Mission provides. Well, I can tell you where. To hospitals that treat patients and providers with respect and deliver on their promises. Here's one recent example. Mission asked Yancey EMS, a 911 emergency service, to take a pediatric patient from Blue Ridge to Charlotte. A 3.5-hour transport one way because Mission didn't have interfacility transport staff to take the child. Our primary duty is to respond to 911 emergencies in Yancey County. We simply cannot take a county 911 truck out of service for that long. We then called Mission Hospital's dispatch service, the same system that oversees Mama Air and Mama Ground, both designed to handle interfacility transports for Mission patients. We were told that the patient was stable and that a flight had been requested but denied due to weather, no fault of the flight service. We were further told that the ground transport was unavailable because Mama Ground only had 2 trucks in service that night. 2 trucks for the entire region. That's absolutely unacceptable. We later learned through a Facebook post from the family that the child's parents had to drive her to Charlotte themselves because no transport was available. By the time they arrived at the ER, their daughter was gravely ill. The family was told that Mission wouldn't accept her because they didn't have a pediatric neurologist that would accept. This is heartbreaking and unacceptable. How can Mission claim to take care of the sickest of the sick when they don't even have a pediatric neurologist available? Our children deserve better than that. It's also unfortunate that local EMS systems, like ours, are often blamed for HCA's shortfalls when it comes to interfacility transports. But our duty is to remain ready for our citizens, the ones not in a hospital bed, not being monitored by doctors and nurses, the ones who rely on us to get to care in an emergency. We cannot abandon them because a corporate hospital system can't manage its own transport network. After this child's story made the news, the report claimed HCA had more trucks on the ground than ever before. Really? Where? Because we certainly don't see them in this region. Then, just a few days later, I came across a Facebook post advertising 130 critical care paramedic positions and 101 EMT positions. Once again, HCA only starts hiring when the bad publicity hits. Before HCA's acquisition, I remember when Mama Ground, then known as Regional Transport Services, had critical care trucks stationed at every outlying Mission facility, specifically for cases like this. Those days are gone and patients are paying the price for it. In 2024, HCA reported an annual gross profit of $59.848 billion. Instead of dragging out Advent's previously awarded CON through litigation, how about investing some of your money into your hospital, your staff, and your communities? And for anyone who doubts the urgency of need for another healthcare option, I want to remind everyone that between September 15th and 19th and September 22nd and 26th, the HHS surveyors were on site at Mission and found multiple serious issues, including patient misidentification, failure to assess a telemetry patient with emergent needs, and failure to ensure safe and appropriate transport. I feel like others were allowed to talk longer than I was. Okay, thank you. Serious issues, including patient misidentification, failure to assess a telemetry patient with emergent needs, and failure to ensure safe and appropriate transport with continuous pulse ox. Some of those failures resulted in death. After this third immediate jeopardy, HCA publicly boasted about hiring 200 RNs. 200. So you're telling me that the hospital was short by 200 nursing positions, and the solution to an immediate jeopardy was suddenly hiring that many more nurses overnight? Mr. Lowe sent an email saying he found it was unusual how long the surveyors were on site. People died. That's why they were on site that long. Recently, at a lunch hosted by Advent at the site of their new hospital, the very hospital Mission continues to delay and block through ongoing litigation. Their CEO spoke directly to what healthcare should be about. He stated their staff is committed to caring for patients and families from a place driven by love and not money. This is not about competition. This is about access. This is about what's doing right for the people who live here. It is also important to recognize that the other applicants seeking these same beds proposed to place their facilities in South Asheville, an area already served by a freestanding emergency department and located only minutes from Mission Hospital in Asheville. Directing additional beds to an already well-sourced part of the region does nothing to address the real access gaps facing our rural communities. Prioritizing Advent's request ensures that these scarce resources are allocated where they are most urgently needed and where meaningfully improve healthcare access for Western North Carolina. On behalf of Yancey EMS and the citizens we serve, I strongly urge the state to approve Advent Health's request for an additional 129 beds. The time for excuses is over. The people of Western North Carolina deserve real access to care, not corporate obstruction.
Steve Judge. Charles Owen. Charles Owen. Okay.
Good afternoon. Thank you for the opportunity to speak today. My name is Charlie Owen. I'm glad to make a statement in favor of UNC Health and Pardee Hospital's CON application for 129 additional acute care hospital beds in Buncombe County. Since 1937, 3 generations of my family have served in various governance roles at both Mission Health and the UNC Health System. I served over 20 years on Mission Health's board of directors and had a term as chair. I was not on the board when they made the decision to sell the hospital to Hospital Corporation of America. In 2024, I finished 16 years of service as a board member of the UNC Health System. I was the board chair of the UNC Health System for 4 years, and that time frame coincided with the pandemic. For my 30-plus years of experience in healthcare governance, I firmly believe in and support nonprofit, community-based healthcare. I'm also very familiar with North Carolina's CON process. At the time of my departure from the board of directors at UNC Health, we owned or managed 20 acute care hospitals across North Carolina. In the last 5 years, and a point of reference for this specific CON applications, member hospitals in the UNC Health System have been awarded more than 200 acute care beds across North Carolina. As a member of the Western North Carolina community, I have reviewed each of these current CON applications. Based on my experiences and on the current situation in Buncombe County and Western North Carolina, the CON should be awarded to UNC Health Pardee, and allow us to build a new critical care hospital in southern Buncombe County to be named UNC Health West. Our growing population in Buncombe County and across the region will inevitably need additional healthcare resources to ensure that patients like me can access vital care. Buncombe County has always been the hub for healthcare services in Western North Carolina. Quality, cost, clinical excellence, the array of services that can be provided are the essential elements needed to be awarded for any acute care beds. Currently, the only hospital in Buncombe County struggles to provide the quality of care and the number of services we currently need and deserve. Across the state, and especially in Western North Carolina, we have a proven record of clinical excellence and quality care. UNC Health Pardee is the only hospital in Western North Carolina to earn both a 5-star CMS rating and an A grade from the Leapfrog Group for patient safety. This demonstrates our commitment to delivering the highest quality care today, not a promise for the future. We're the only applicant that operates exclusively in North Carolina. Our decisions are made here for North Carolinians, not at out-of-state corporate headquarters in Orlando, Florida, or Nashville, Tennessee. We will continue to make Western North Carolina a priority, not an afterthought. We operate the largest medical school in North Carolina. It is our duty to provide the next generation of physicians in this state and beyond. Healthcare providers with a focus on teaching, maintain higher clinical standards, and stay current with the latest evidence-based practices. Having medical students and residents in our community hospital means better outcomes for patients and ensures our providers have access to continuing education and professional development. There are currently 35 medical students and numerous residents receiving their education in Western North Carolina through our strategic partner, MAHEC, which you've heard about today. We also provide an extensive physician network across the region. We employ 60 primary care providers and 72 specialists today. We had over 280,000 patient visits last year. It's also very important to note, 225 physicians signed letters supporting our CON application. We are true partners. We cannot be successful without the support of physicians across the network and across our communities. Personally, my family has received excellent cardiology, orthopedic, and pulmonary care at UNC Pardee in the last several years. As I've said, acute care beds should be awarded to the applicant that best demonstrates the ability to provide cost-effective, high-quality care by collaborating with physicians, staff, and the communities they serve. UNC Health West deserves to be awarded a CON to build a new 129 acute care hospital in Buncombe County. Thank you.
Guy Bennett.
Good afternoon. Thank you for the opportunity to speak. My name is Guy Bedette. I'm here to advocate for Novant Health's application. The primary reason being options. I believe having another provider, in having another provider in Buncombe County besides the three that we have in the area now between Buncombe and Henderson County. I live in Fairview, so that's kind of east central Buncombe. I'm speaking just as an average citizen. I'm not a mayor, a former mayor, a city council member, or a healthcare provider. I'm just an average Joe that needs ongoing medical care, both for my wife and myself. I've had some health challenges. I have cardiac issues and a primary gone to Mission, frankly, because to me, that's the only option that's close. I see a cardiologist at Asheville Cardiology, which is affiliated with Mission. I found that getting timely care from my cardiologist can be problematic here. Scheduling office visits means multiple calls months in advance to find an available time slot. Almost a year ago, I was diagnosed with atrial fibrillation. I had my annual checkup with my cardiologist at the end of May of this year. He recommended here at Asheville Cardiology, he recommended that I have an ablation for that condition, which is a common procedure for atrial fibrillation. The wait time just to get a consultation with an electrophysiologist here was 3 months to see an EP here in the Mission system. It was at that point I decided I would seek care for this problem outside the area. I decided to go to Emory in Atlanta for various reasons, but the care I received there was excellent, by the way. I was able to see an electrophysiologist at Emory within a week of requesting an appointment. And then I had the procedure about 2 months after that. So in about the amount of time it would have taken me just to get a consultation with an EP here in Asheville, I was able to have the procedure done in Atlanta. But I had to go to Atlanta to have it done, not here. And that's not, I think, what access to care should look like in our area. My wife is a breast cancer survivor, and she's currently a patient of Novant Health's women's specialty care, and she's now seeing a surgeon at Novant Health's Plastic and Reconstructive Surgery Center in Biltmore Park. Her experience with both of these providers has been excellent, and I've been with her on multiple occasions to see these providers and have experienced the same in just talking to the providers versus my experience with other providers in the area. Aside from specialty care, we also had a great experience with Novant Health after Hurricane Helene. My wife needed medical attention. She had a minor injury. In the days after the hurricane, we visited Novant Health's mobile urgent care center that was set up at AC Reynolds High School out in our area. And they took great care of her. That's the kind of access and responsiveness that I think we need in this area. So I need ongoing cardiac care right now, and I don't have access or feel I have sufficient options in the area that's close enough to me. Yes, maybe I could go to Advent in Hendersonville. I don't feel like driving all the way down to go see a cardiologist in Pardee, but so that's what I'm looking for, additional options. I still drive to Atlanta now when I need to see my electrophysiologist. Expanding capacity for the current providers doesn't really help unless you can expand the services being provided. While I appreciate the need for the expansion in areas like northern and western Buncombe County, those will not meet my needs or the needs of the members of the area that I live in eastern Buncombe County. So that's why I believe having Novant Health here would give us more healthcare service options and therefore potentially better care. Thank you.
Mark Snelson.
See, good afternoon. I am Mark Snelson. I'm a director of Madison Medics and EMS. I was so excited last week. I had a friend call and say, hey, we have got the CON for the Weaverville Hospital. It was like Christmas. Yesterday, I got a phone call where there was a patient from Asheville had drove to Hot Springs and was wanting us to take her to Knoxville because she did not want to go to HCA. So over the years, I worked for HCA or Mission, and they were wonderful. But whenever HCA took over, we lost our contract, Madison, Yancey, and Mitchell, with the hospital, and due to them wanting to double what we paid them per year. So also in that contract, they said, if we don't make money, we are going to add 10% on to this. So that's why we went to a private service. Now, the next step in our process is getting additional 129 beds approved. And you asked why I say our, because Advent has shown us firsthand that all they're committed to partnership and full support in Madison, Yancey, North Buncombe. So everybody's got up here and spoke about UNC Health, which I'm a Tar Heel fan. John Grindstaff's in here. I know he's a Tar Heel fan. And my mother passed away in 2002 at Chapel Hill. So I'm love UNC, love them being nonprofit. It ought to be against the law to be a profit hospital. So we continue to take people from Madison County over to Johnson City, Newport, Knoxville. We have a hospital that's close to us that has told us we don't, and it's not, none of these hospitals here don't bring patients here. We just want in-county patients. So we get a variety of dealing with stuff like that. So when it comes to these 129 beds, everybody's got up here and talked about we need these closer to the community. Not one person except Dr. Maxwell. I don't know if he's still in here, but he hit it on the head. He said Madison. He said North Buncombe. He said Yancey, Mitchell, Avery. We have been left out, and UNC, Novant, great hospitals. They're wanting to build in South Asheville. Well, between Mission Hospital and Pardee is 18 miles. You'd have 4 hospitals within 18 miles. So we have 22,000 people in Madison County. Yancey has 18 something. That's 40,000 people with no hospital in their county. We have 455 square miles in our county. They have 318 in Yancey County. Our health department director is here. We have a great health department. We have 4 clinics in Madison County, but come about 5 o'clock in the evening, there's nothing open. So we don't have no other choice but to come to Mission. I've been to Mission twice this year, got great care, finger and saw and kidney stones. It's not about that. It's about bringing this hospital with 129 more beds to Weaverville. So I live 2 miles from the Tennessee line. So I am about an hour from Mission. So the people I serve, Madison County, there's some of them that's over an hour. when you get on Spring Creek, when you get on Laurel, when you get on Big Laurel. So our layout of our county is huge with just 22,000 patients. But what a difference it would make with us with 3 ambulances. We rely on Yancey, we rely on Buncombe, we rely on Haywood. We've gotten trucks out of Newport, Tennessee, where we get bundles of calls and we have to have mutual aid. So there's times when there's 4 or 5 other agencies in our county because we have 3 trucks. So this hospital in Weaverville, that would get us back in service 30 to 45 minutes quicker, because with the road construction stuff, it's 15, 20 minutes from Weaverville to the hospital sometimes. It's going to get worse. And so some of our trucks are gone for 2.5 hours at a time from that location, from Hot Springs, from Mars Hill, from Marshall. So it really make a big difference for us 40,000 plus, because I don't know how many's in North Buncombe. I assume 30, 40,000, to have a hospital that we call ours. I used to call Mission Hospital ours, but when HCA came in, the greed. I wanted to talk about greed. Everybody knows what greed is. So there's people that we have to leave home that says, I'm not going to Mission. I'll stay here. You take me to Advent. You take me. We can't take you to Advent. We have 2 trucks out. We only have 1 left. We got hung out with traffic for 3.5, 4 hours with 1 patient to Advent that we took to Hendersonville. So my question would be, why would we want to give 129 beds to an area that already has 3 hospitals within 18 miles? That needs to go to Weaverville. Thank you.
Van Duncan.
Good afternoon. Good to see y'all. My name is Van Duncan. I'm here to speak on behalf of Advent Health and their proposal to expand their beds at the Weaverville site. I hope to bring a little bit of unique perspective today, because I used to be the sheriff in Buncombe County, served there for 12 years, and I'm currently the chief deputy in Madison County and serving under Sheriff Harwood, and I'm here to represent him today. What I will say is, one of the big surprises I got at Madison County, if you have a health event that requires trauma intervention, you're probably going to get a helicopter ride. Now, Dr. Maxwell said he hoped to get a helicopter ride one day, but I can tell you, having loaded somebody in that helicopter as they left, that adds to that event. That adds the stress to the family and to that event, but we're very appreciative for that service. What I would say is we're very appreciative to Mission Hospital for providing that acute trauma care. They do a great job with that. But why wouldn't we want 2 trauma care centers available to us? So by expanding what Advent is already building, it's going to enable them to pursue and build a trauma care center there that gives access to people that have little to no access right now. I have to agree with Councilman Bo Hess. Sometimes competition's a good thing, right? Especially when it comes to delivering healthcare services to patients. Some other perspective I have is, I don't know if you noticed, but I'm getting a little older. If I ran into you about 15, 18 years ago, I looked a little younger, and with that perspective comes, I have a lot of friends who are older, who receive healthcare services. And what you will always hear from people going to Advent Hospital is they provide for that patient's health care first, but they also attend to emotional and spiritual needs as well, which is a very unique thing and something that's very appreciated by our folks in Madison County, and I think most folks. Also, they are a great community partner. One thing I've seen since they've come in and started to build in our area, and thank goodness they were allowed to build and complete this hospital, One thing I have seen from them is they come out to community events and they say, this is what we do, but how can we do what we do that better serves and helps you? And we've heard that. Mark Snelson has heard that. Our commissioners have heard that. And we're very appreciative of that. And the last bit of perspective I would share with you is I'm fortunate enough to be married to a registered RN who is a very good nurse. She's worked for two of the companies who are proposing to acquire these beds. And I don't want to be negative at all. But what I want to say is when I asked her about Advent, so what's the most positive thing you could say about having worked for Advent Health? She said they genuinely and honestly pursue excellence every day. Now, I can tell you from somebody who's run an organization and helps run an organization, there's probably not a better compliment that can be had. But I would ask, thank you folks for being here to listen to us today. You can tell we're pretty passionate about this. We just want to really see services available for folks who have had very little access in the past without limiting services to people in Buncombe County, because this hospital is still going to be in Buncombe County. Thank you.